is a pantropic virus, meaning it has an affinity for all types of cells in the organism. This explains its severity, as the patient can present with respiratory, digestive, dermatological, hepatic, and, most seriously, neurological symptoms. It is not limited to the respiratory system, as one might think, which underscores its seriousness, especially when neurological symptoms appear. Since it is a disease that affects all cells, the symptoms that can be observed include typical signs of many illnesses, such as lack of appetite, inactivity, apathy, and discomfort, among others. This is why a thorough history and careful observation of all signs are crucial to avoid confusion with other diseases. However, some symptoms that may raise suspicion of this disease include green mucus in the nose along with greenish eye discharge, difficulty breathing, also known as dyspnea, vomiting, diarrhea, thickening of the skin, especially on the paw pads, greenish pustules in hairless areas, and more aggressive symptoms in neurological cases, such as lack of coordination, nervous tics, and even seizures, potentially leading to the tragic outcome of the patient's death. This disease affects both puppies and adult dogs equally. The disease is transmitted from sick dogs or healthy carriers and is spread through sneezing, urine, feces, transplacental transmission, saliva, and even skin shedding. With a high number of transmission methods, the virus can survive in the environment for up to 6 months, making it highly resistant. Inside the patient, the virus can have an incubation period of 2 to 15 days before symptoms appear and has a 90% infection rate in unvaccinated dogs. In addition to diagnosing the patient based on the aforementioned symptoms, the disease can also be suspected based on the patient's origin. This is primarily determined by the veterinarian's experience and word-of-mouth information from the local community. For example, in some areas where pet trading is common, this disease is widespread. To obtain an accurate diagnosis and avoid confusion with other diseases, a sample must be sent to a laboratory to confirm the presence of the virus. The problem is that these tests often take at least 2 to 3 days, time we cannot afford to lose. One important point to clarify is that, to date, there is no specific treatment for viruses. There are no medications that directly affect viruses like antibiotics do for bacteria. While some medications can limit viral entry, they are not fully effective. We rely entirely on the immune system to produce antibodies and destroy the virus. The only measures we can take are supportive treatments, such as analgesics, anti-inflammatories, and antibiotics to combat secondary bacterial infections, ensuring the immune system is not distracted. Additionally, intravenous fluids are recommended to prevent dehydration caused by diarrhea and vomiting, as oral administration is often ineffective due to vomiting. Beyond that, all we can do is wait. Remember, the only way to prevent this disease is through annual vaccination. It is important to note that unvaccinated dogs or those with immature immune systems can face a 90% mortality rate. When neurological symptoms appear, death is almost inevitable because antibodies cannot effectively cross the blood-brain barrier. However, if the patient survives the neurological presentation, it is very common for them to experience sequelae, such as nervous tics, due to the brain damage that occurs. In addition to dogs, distemper can affect other species, and the disease is even more aggressive in them. Ferrets, minks, seals, hyenas, raccoons, and coatis can contract it. However, humans cannot contract it, so you can rest assured if your pet has distemper. To prevent this disease, the only option is vaccination and avoiding contact with other sick dogs or those suspected of being infected. The vaccine is a preventive measure, not a guarantee that the dog will not get sick. When vaccinated, the dog is protected up to 80% under adequate conditions. And with each subsequent vaccination, the remaining 20% is reduced by 80%. This is why there's always a small margin of possibility, but it is still important to vaccinate them annually. Another way to prevent the disease in unpleasant situations is to acquire pets from places where hygiene is optimal, where chlorine or other powerful disinfectants are used to clean the facilities where the dogs are kept. However, in my experience, The best places to acquire a pet are from private individuals, as they usually have better control over the mother and the environment, which is generally very clean. Additionally, these individuals tend to care deeply for the puppies, and you can verify if the mother of the puppies has been vaccinated. But if you have had the misfortune of your dog contracting the disease, whether it survived or not, the most advisable course of action is to wait 6 months and thoroughly disinfect your home. This way, the next dog you consider acquiring will be safer from the disease. Remember that impulsively acquiring a dog will only lead to unwanted situations, especially for your pet. I hope you enjoyed the video. If you did, please give it a like and share it so more people can discover this channel. I'll leave my social media handles so we can stay in touch, and I'll also make relevant announcements about the channel through those platforms. If you're new here, I invite you to subscribe. Thank you very much for watching this video. See you next time.